This is the Your Files page of Compass. These are 4 messages from patients on the left-hand side. These are the guidelines for anticoagulation. We'll get into different parts of this menu at a later time. The INR patient list is the main place to work. It has 5 different menu options. Active patients, yes, there are no patients now because there are no active real patients. Past due, these are active patients that are past the expiration time for their INRs. Critical values, these are INR patients active who are, who have critical values for very high or very low INRs. Inactive patients, as we'll see in a bit, you can take any active patient and make them inactive. By doing that, you can take them out of the statistics for the coagulation clinic and out of the graphics. So these might be patients that died or moved out of the area or decided to not use the system. We're going to spend most of our time with test patients. Test patients is a special category. All of these patients start with ZZZ in the first letters of the last name, and they are automatically excluded from INR trends, TTR trends, and other statistics related to the group. The patients that you're looking at are part of the CHUK coagulation clinic. By changing these options, we can select different clinics, and by doing that, look at a different set of patients. The administrator view, admin user view, is a location which shows all clinics, all patients for all clinics. So this is the view that most providers in the coagulation clinic will be using. We'll just look at test patients for the moment. And if you look at this first patient, it's the patient's name, their number, which clinic they're associated with, and their status, which of course is active. As we'll look at later, if you click on this link, you will get to a chart view of the patient, which shows a lot more detail about the history of the patient and various settings. The second column is the SMS column. This has to do with messaging, and you'll see here under Test David, there are numerous settings that can be set here. The important ones are at least one phone number, that's SMS capable phone. You can have up to 5 different phone numbers, which may seem excessive, except that many patients have their phone and a family phone or a friend's phone. In addition, having multiple phone numbers allows the patient using an SMS conversation to update and change their own phone numbers without being disconnected from the system. SMS literacy means that that the patient understands how to use SMS and is literate in their preferred language. The SMS language has three options in Compass. It can be English, Kinyarwanda, or French. And depending on what the setting is, the communications to the patient will be always in the patient's preferred language. There are two different SMS modes. Level 1 are the basic functions, and those have to do with getting reminders from the system, seeing dietary recommendations, changing phones, changing language, and several other functions. For more advanced patients or patients that have difficulty getting to a clinic, there's the level 2, which includes all basic functions, but in addition to that, allows the patient to enter their INR values and then to automatically receive warfarin recommendations. Most of our patients will have one of these indications for warfarin. And this surgery history allows us to select or deselect, why the patient is on warfarin therapy. You can also put down one or more surgical dates if you wish. And then there's a place for comments where you can add other indications or other medical considerations for the need for warfarin therapy. There are three INR ranges, which should be set appropriately depending on which kind of heart valve the patient has in or what the indications are. And last but not least, the coagulation clinic will default to whatever is set up here, but this is important in order for the program to identify that the patient is assigned to a certain clinic. When you save this, if this is the first time the patient has been connected, you can send a message by SMS to welcome the patient. The third column has to do with the last INR. So obviously the date the last INR was done, what the INR was 3, what the goal was, what the TTR is, and warfarin and the current warfarin dose. The fourth column has to do with the next INR. So in this case, the program is determined, or the operator has determined that the INR will be due on April 20th. Its status is now 10 days old. Underneath this third line, and in some cases there are more, indicates that the program sent out and automatically sent out a reminder to the patient. So on May 3rd, the program, Compass, sent out a SMS reminder to the patient to remember to get their INR test. The graphic shows the INR values for the patient over the past 12 months. The icons in green are within the therapeutic range. The icons in red are either below or too high. If you hover over one of the icons, you can see the date and the INR and the warfarin dose. If you then click on it, you can see additional detail of when it was done, any provider instructions, and things like and other detail related to that date. The the buttons to the far right are action buttons. So in this case, we're going to select this patient is not connected to SMS. So we're going to assume that the patient is in the office or in the coagulation clinic. They just had a test done. Now let's say it's 3.1. This is the current date. The warfarin dose is based on what it was previously. So let's say the patient was taking 15 milligrams per week, which ends up being an average of 2.1 milligrams per day. This can be changed if the patient is actually taking something different than what they were supposed to. These check marks indicate whether the patient has had any recent bleeding or trauma that the provider should be aware of. Click recommendations, and the program will algorithmically then determine what the new dose is. So in this case, dose is 17.5. The new warfarin dose is the same. And the reason it's the same is because the INR is just slightly high. Print translated patient instructions for the patient. So when we save that, these instructions will be printed in Kinra and can be printed sent on a printer, and then handed to the patient. And so that data point that we just brought in is here. For patients that are SMS connected, in this case, this patient, we have the same kind of feature. Let's say 4 this time. And this time, the program has determined that the INR is high. They're going to reduce the warfarin dose to 37.5 from the 40 that the patient was on before. And we'll be following this schedule with 5 milligram tabs. And the default would be to send the translated instructions to the patient by SMS. So by clicking the button, the instructions were sent by SMS, and the program saves the data.